Hi there and welcome to this tutorial on plantar fasciitis. My name is Karl Locket. I'm a sports podiatrist in Sydney, Australia. I trained in Manchester in the UK and my area of interest is plantar fasciitis, and I've been working with this condition for approximately 10 years. So if you're watching this video, you're probably suffering with heel pain or plantar fasciitis, and I'm going to run through a few things today and explain to you a very successful way of treating this condition, and also I'll run through a few other things, a few reasons why I think a lot of different treatments have failed to help the condition itself. Okay, so first of all, a bit of a background on the plantar fascia itself. The plantar fascia is a large ligament type structure running through the sole of your foot. It runs from the base of your heel through the arch of your foot and attaches into the base of your toes up at this end. It's quite a large structure and it's responsible for some of the strength and stability in the foot. Now, if you are suffering with plantar fasciitis, you probably get pain first thing in the morning when you take your first few steps, pain after you've been sat down for a given period, you probably hobble around for a few steps, then that pain probably drops off a little bit, allowing you to walk a bit more easily. But you'll probably find that the pain lasts all day and you'll get shooting pains in your foot. A lot of patients will describe this condition as the feeling of a stone bruise sensation or a pebble in your shoe right underneath your heel. And now the treatment that I have the most success with plantar fasciitis is with orthotic therapy, but only because I apply some very specific principles into the design of my orthotics themselves. Okay, now you may think that all orthotics are the same, but this is definitely not the case. They can vary dramatically. Even if they look the same in appearance, they work differently. It's like a pair of spectacles. You might have a few different pairs of glasses on a table. They all look the same, but you put each pair on individually and they work very differently. And these same principles apply with orthotics. I'm just going to outline some basic principles of orthotic therapy. Principles which I find are often overlooked, and after which you'll probably understand why some orthotics work and why a lot of orthotics fail to help plantar fasciitis. When an insole is designed, there are two areas of that insole that can create support for the foot. Okay, one is the arch contour of this insole, which is very obvious and traditional. The other is a wedge, a bit like a door stopper, that's placed around the inside heel area of the insole. Now, your individual foot function will determine which of these two areas of support you actually need. You might need an insole with a good strong amount of arch support and a tiny bit of heel wedging, or you might need an insole that has a very low and gentle arch support but a lot of heel wedging instead. Okay, let me give two examples to try and help explain these principles. First of all, I use the example of a foot which collapses. So if the arch of your foot drops or your foot collapses when you walk, then you should not be using orthotics that are designed with arch support. This type of orthotic will push up against the arch of your foot, against the fascia as the arch collapses, and will feel like you're walking on a tennis ball. It will put too much strain on the arch and on the fascia and will aggravate the condition. So this foot type we find will benefit much more from an orthotic that's designed with gentle arch support, just a little bit of contact through the arch of your foot, but we control the foot instead with that little wedge, with the little door stopper that's positioned around the inside heel area of the orthotic instead. So basically we're going to support this foot without pushing against the fascia. Now for the opposite foot type, which is the foot with a higher arch that doesn't collapse very much. So this foot type will benefit from the opposite type of orthotic that is designed with a very full arch and a minimal amount of heel wedging. So this orthotic must be designed very accurately so that the arch height of the orthotic marries exactly with the arch height of the patient's foot. So from a practitioner point of view, it's really important that we get a very accurate foot mould or a foot scan and get a very accurate measurement of the patient's arch height, so that the arch contour of the orthotic makes good contact with the arch of the patient's foot, therefore supporting the fascia and relieving the stress and strain from the fascia itself. So from these two basic principles that I've outlined here, you can probably see that orthotic therapy is not as simple as it first may seem. And just because you have your feet moulded by a podiatrist or a practitioner, it doesn't mean that you're going to get the right orthotics for your feet. It really is all about the design, especially with a condition like plantar fasciitis that is very stubborn and very painful. Now, there are lots of other variables in orthotic therapy as well, and these principles that I've gone through here are just the tip of the iceberg. So my advice to you here is to do your research, find a good qualified sports podiatrist who specialises in orthotic therapy, and preferably one who's had some good success in treating plantar fasciitis. Now, within our practice, plantar fasciitis is obviously the most common condition that we treat, and we always abide by these principles of orthotic therapy because we see how beneficial it is to our patients. When we fit these patients with these right type of orthotics inside their shoes, they're usually cured and free from pain within a matter of weeks. So my point here is to find out what foot type you are, and make sure you're wearing the right type of orthotic for your foot type. Now, obviously the best way for you to do this is to visit a good qualified sports podiatrist and have them video your feet as you walk on a treadmill and make all of the necessary measurements. Now, there are lots of different home remedies that you may have tried to help with your plantar fascia problem. You might have tried rolling your foot on a frozen bottle of water, rolling your foot on a golf ball, pulling back on your toes, pushing your toes against the wall, hanging your heel off a step. Lots of these little different remedies that are very, very popular. My advice to you is to be very, very careful and perhaps refrain from these remedies. And I know that's a bold statement because these treatments are very, very common. However, I have found with a lot of patients that these remedies further irritate the fascia. Rolling your foot on a hard object can put more pressure on the fascia and irritate it, and certainly stretching the sole of your foot can further strain the fascia and cause it to pull more on the base of your heel. So even if these remedies give you a little bit of relief in the short term, which is very common, there is the potential that they're aggravating your foot in the long term. So just be very careful with these remedies. Likewise, if you've tried using arch supports in your shoes, you may have also found that these have aggravated your foot, and that's the same reason why. The arch supports are designed to push up against the arch of your foot, which really means they're pushing against the plantar fascia. Again, that can put more pressure on the fascia itself and just cause a bit more irritation, so just be careful with that too. So although orthotic therapy is often the quickest and the most successful way to treat plantar fasciitis, it's not always essential. With some patients we can give you some very specific stretches to do, we can get you to avoid those home remedies that we spoke about earlier, and we can give you some good footwear advice and get you to put ice packs on your feet, and you still have a great chance at getting rid of this nasty condition. If you want some more information, then you can visit our website, which is www.sydneyheelpain.com.au, or you can email us at enquiries@sydneyheelpain.com.au, or call one of our staff on 02 9439 7811. I hope you enjoyed this educational video on plantar fasciitis and that you learned something today. Feel free to ask us as many questions as you like. And have faith, you don't have to live with plantar fasciitis. Good luck.